Hello, I'm Dr. Plemon from Chiropractic, and I'm here to take a minute to talk about how the Atlas Orthogonal Percussion Adjusting Instrument works. That's a mouthful. Around the office we just like to call it the AO instrument. The instrument delivers a precise vibration or percussion force to a very small point on the C1 or Atlas vertebra on the patient. This is located just below your ear. When this red button is pushed, a solenoid is fired, and a spring-loaded cylinder comes down and strikes this long, thin piece of metal called a stylus. The force goes through the stylus into the patient, into their C1 vertebra to move it back into its proper alignment. The instrument works very similar to a game of croquet. If you have two balls up against each other and you put your foot down on one ball and strike that ball with a mallet, the force goes through that ball and out the other end, and that second ball goes flying across the yard. The instrument works the exact same way. It only uses about 4 pounds of force, which isn't very much. The question we often get is, how does such a small amount of force move my bones around? Well, remember, we're only moving a 2-ounce bone a couple of millimeters. So you want to use just enough force to move the bone without putting any additional strain on the neck. The key to the adjustment is the speed of the instrument, which is much faster than human hands could ever be, but also the precision of the adjustment itself. Very specific x-rays are taken in order to determine exactly how the atlas has misaligned, and we use that to get the proper angle from the instrument to get a good correction for the patient. In the adjustment, the force itself is just a vibration, so the patient hardly feels it at all. However, a very careful examination is done before and after the adjustment, and the patient will often notice better range of motion and less tenderness in the area of the neck with a good adjustment. We also take post x-rays to make sure that we get a good correction, and if we don't, then we can always make changes in order to do so. And then on subsequent visits, that same examination of the neck is performed to know whether or not the patient is holding. If the patient is holding, we don't touch it. We leave it alone and we allow it to heal. However, if the atlas is again out, we of course make the same adjustment. As long as the atlas clears properly on the visit, we know that we got a good correction. And then if we can keep it in place and the patient can start to hold, then the healing begins. Hopefully that helped you understand how the adjustment works. If you have any questions, feel free to use the comment section, or of course you can always consult one of our doctors if you have any health concerns to see if this method of chiropractic can help you. Thank you.